Hi, my name is Christy Ingram, and I have Jennifer Jones with me, and she has a 2-month-old child, and we're going to be reviewing the Learn the Signs, Act Early, and then going over our 2-month checklist milestones. So, all right, so I've printed the PDF out for her, and we're going to look at that. Okay, so we're going to be talking about some signs that, the importance of why we need to look for milestones and signs in children, and why it's so important. The first thing is, the biggest thing is milestones. A lot of times when you go to the doctor, they're going to ask you, is your baby doing smiling, or is your baby crawling and stuff like that. And those are all milestones. And so they ask a lot about those because they want to see if there's some kind of disability or an issue or a problem. And it's very important that earlier we catch this disability, if there is, the better it is for the child because they can start treatment services right away. So what I have is just this PDF. It's a free resource. If you want, I can forward it to you. And it'll just tell you what we need to look for as a parent, for your child as they grow. All right, so as we mentioned, what are development milestones? Things most children can do by a certain age. And there's always probably a little exclusion here or there, but these are the things that, according to what normal, typical age children do at each age, is achieving. And they're usually about how a child plays or learns or speaks or acts, and they offer important clues about your child's developmental health. All right, so what we want to start with is tracking your child's milestones. So what we're going to do is go over some of this information on how to track. We're looking for milestones, and it's easy and fun. It's really important. A lot of times parents automatically know this without having to track it, but as we get on, I'll show you a sheet that we can track it for, and it's really beneficial for you if you would fill that out and take it with your doctor, because sometimes when a doctor asks something, you're like, oh, how long has he been doing that, or how long has she been doing that? And you don't really know, but if you kind of keep track, you have a better idea. So we want to track milestones over time. It helps to understand your child and what to expect. It helps to be sure that your child is developing well for his or her age, and it provides important information to share with your child's doctor at a checkup. So here we go, we've got one with a baby crawling on it, and it says, tracking your child's milestones give you the chance to catch early signs of possible developmental problems so that your child has the best chance to get the help he or she might need. And studies and everything have shown that the earlier a child gets help with services, if there is a developmental delay or anything of that nature, the better their chances are of progressing and succeeding. All right, so this is a free milestone tracker. And there's a different couple of options that they've got here as examples. Does your child climb well, explore things, build towers, and of course your child is not in that age group, but that's just some of their examples. And then here we go is just a actual sheet that we're going to go over here in just a few minutes, and it's called Your Baby. This one's at 9 months, but we'll do a 2-month-old from McKinley. And checklists start at 2 months and they go through age 5. So that's when we really want to be focusing on this. And they list the milestones across 4 areas of development, and we'll discuss those when we go over the checklist. So what they recommend is that you post a copy of this on your refrigerator somewhere convenient, and as your child achieves those, go ahead and mark them off. And then take this with you on a well checkup and share it with your doctor. Okay, so this is just some a booklet, a little more on it, on how it kind of looks and goes. Sorry. Okay, and so the booklet, it includes full checklist for 2 months through 5 years, and some activities to help your child learn and grow, and spaces where you can write down questions or anything that you think of. So if you keep it up maybe on this one sheet, then you can write down all your questions as well, and it helps you remember everything you need to know for your visit. It's recommended that you try some of the activities during playtime, because that seems to be a good time to look for some of the milestones. Okay. And then there is a growth chart in this paper, and so you could always chart your child's growth to see how they are from visit to visit. All right, so the first step in trying to make sure that your child is on track, or if they're having some developmental delays or anything like that, is the first step is to track your milestones. And each age group has different milestones that they need to reach by a certain age. Try the activities to help your child learn and grow. And talk with your provider about milestones and anything that you see with your child or anything that may be concerning to you. And talk to your child about progress and what you can expect next. As mentioned earlier, act early if you ever have a concern. Okay, so act early. You obviously know your child better than anyone. You spend more time with them. So you see them do things, you know what they can do, and you're your child's biggest advocate. So it's very important that you advocate anything or any concerns or anything that seems amiss or questions that you act on when you talk to your doctor about them. No one knows your child like you. And then if you have any concerns, share those with your doctor. They also list a number here for the CDC for referral information and specialist information. And then each state offers services that can help. Here in Georgia, if you were to have notice something, your doctor may refer you to Babies Can't Wait, and then they'll come out and do an evaluation and decide from there what's going on with your child. So, and then go from there for services if need be. But that's just kind of a base on how that works. Okay, and a lot of resources are free. The state has programs set up that they provide these free. They want to try to help these young children as much as they can while they're young. And honestly, we really talk about acting early. It really makes a big difference in children that receive the services early. So in conclusion, we want to help your child learn and grow by spotting every amazing milestone moment. If you'd like, I can send you this just so you have a copy of it with some of the information, and it has the milestone checklist in it.
Okay.
But do you have any questions about the importance of talking about the early milestones or anything like that?
No.
No? Okay. Well, I pulled one for 2 months. Your daughter will be, is right around 2 months, so we went ahead and pulled the 2-month checklist for you, and I'm going to ask you a couple questions if you don't mind.
Okay.
Okay. So I'm going to read you just what it says at the top. How your child plays, learns, speaks, and acts offers important clues about your child's development. Developmental milestones are things that children can do by a certain age. Check the milestone your child has reached by the end of 2 months. And she's right at 2 months, correct? Okay. Take this with you and talk to your doctor. Talk to your child's doctor at every visit about the milestones your child has reached and what to expect next. If I give you a copy of this, I'll send it by email. It's got every month, like 2, 4, 6, 8 on up through. Okay, so as we talked about, there's different domains that they're going to look through. They're going to first look at some social and emotional domain, and then how they communicate or their language. Cognitive, which is their learning and thinking, and problem solving, and movement. Now, as you go on and your child gets older, I'll show you a couple more. These will get more intense with more things under them.
Okay.
But since she's young, there's just a few things under each domain. Okay, social and emotional. Does she begin to smile at people?
No.
Can briefly calm herself? Could be
By herself?
Right. If she gets upset, can she calm herself without you coming in and?
No.
No. Okay. And does she try to look at the parent, or does she
Yes.
try to look at you? Right. So under language and communication, does she coos and make gurgling sounds?
Yes.
And if she hears a sound, does she turn her head to look for it?
Starting to.
Starting to. So she is making some initiation toward it? Okay. Perfect. Okay, under cognitive. Does she pay attention to faces if you're holding her? Does she try to look into your face or look at other people's face?
Sort of.
Have you noticed her beginning to follow things with her eyes or recognize people from a distance? Maybe she hears your voice and she turns to try to find you or dad?
I've seen her move her eyes, yes. But from a distance, I haven't paid attention.
Okay. So without her being directly to you, would she?
So like if I walked into the room, if she heard me, but I don't know if she, without hearing me, if she would know to look at me.
Right. So if she heard your voice, she might turn around.
She
and
might
look
turn,
Okay.
yeah, try to turn.
Perfect. And then she begins to act bored if the activity doesn't change. So if she's doing something she doesn't like and she gets tired of it, does she start to cry and get fussy?
She can.
Okay. Perfect. And then the next one is movement and physical development. Can she hold her head up? Can hold head up and begins to push up when lying on her tummy?
Not yet.
So is she holding her head up at all, or
She can hold it up a little, but she's still.
she's not
tiny.
pushing up or
Yeah.
anything?
Mhm.
Okay. Make a note here. then the next one is makes smoother movements with arms and legs.
Not yet. It's still kind of the.
Jerky.
Mhm.
Okay. I'm just writing these on here. All right. Okay, so we have at least this filled out when she goes for her next visit. You can refill it out if you want. Made some notes here just for this. All right. Act early by talking to your doctor if your child she doesn't respond to loud sounds. So if she heard like something fall on the floor, does she respond with
She
that
does.
startled?
Mhm.
Okay, so let's go ahead and mark that one off. And doesn't watch things as they move.
I mean, she's getting there. I don't think she's quite there yet, but
So if you were to swing a rattler or something in front of her face, would she look at it and watch it, or would she?
no.
No. Okay. You said she's not really smiling at people.
Not yet. Mm-mm.
Okay. And does she bring her hands to her mouth?
Yes.
Yes. Okay, that's good. And can't hold head up when pushing. She really is not pushing up at this point. It's just a
Right.
brief up and down.
Yep.
Okay. All right. Okay, so here's the things that they have on here about talking to your doctor. So there's the list on that. So maybe something that you want to discuss with the doctor.
Okay.
You know, all babies develop differently and at different rates, and it doesn't indicate anything, but it is something definitely you might want to mention to the doctor. So keep an eye on it.
Okay.
So I really appreciate you being with me today and helping me on this. Is there any questions or anything you can think
No.
of?
I mean, are there any signs that I should be looking for other than? I mean, she's only 2 months old,
Right.
so.
Because she is only 2 months old and, you know, there's a lot of things going on, that's why they make these checklists.
Okay.
And so ideally what you want to do is, you know, at the end of 2 months, I mean, as you begin to see between, you know, 2 to 4 months, you'll see the 4-month list right here. See, it gets a little longer. Ideally, probably you want to start, as you start to see the things, you might want to note them.
Okay.
And these are our biggest things, you know, especially with babies, because in my opinion, is the milestones is what you're looking for, because it's not like your child can tell you everything, and these are the things that should be going on a typical child of that age. And so if ever there's a question or anything like that, you always want to talk to your doctor about it.
Okay.
Not definitely meaning anything either way, but it's just the basic guidelines that are set forth by, I think it's the CDC, that these are the things we need to look for by each
Okay.
age group.
Is this based on if she would have been born at full term? So if she was born early, then she may be a little delayed just because she was born a few weeks early. Okay.
Okay, I'm sure it doesn't state for sure if it's based on, you know, whether they were full term or early. So again, you know, if she was born 5 weeks early. So again, it's, you know, that will factor probably into a lot.
Okay.
Just, you know, as experience as a parent that's seen that, I don't know how it
So
goes
she gets
into
fully
this
trained.
guideline and stuff, but it's definitely something to follow this guideline and talk to your doctor. She may tell you to do it differently or however, but at least this is a starting point for you.
Okay.
Okay? I appreciate it. Thank you.